Oxygen administration is a process of administering supplemental oxygen to the patient, which could be done using tubes or face masks. Purpose, this is to relieve hypoxemia and maintain adequate oxygenation of tissues and vital organs. Also, to provide moderate oxygen support and higher concentration of oxygen and or humidity that is provided through the cannula. So, the equipments that we're going to use are the cannula, cleaning solutions, face mask, oxygen delivery device, humidifier, oxygen supply with a tape, and nasal cannula and tubing. So considerations before, during, and after the procedure. First, do proper hand washing. Check order for oxygen, including administration, the flow rate or percentage of oxygen. Check level of oxygen and carbon dioxide in patient's arterial blood, and document the findings. Things to document after the procedure is to document the findings and the procedures that were done. So without further ado, let's start the procedure. First, check the doctor's orders. This is to determine the need of oxygen therapy. Prepare the necessary equipments to save time and effort. Post no smoking signs in the door and in view of visitors to ensure safety. Explain the procedure to the patient to facilitate compliance with the procedure. So, ma'am, I'm going to do an oxygen administration. Is it okay with you? Now, make sure that the humidifier is filled with sterile water at the appropriate mark. So, supposed to be that this is our humidifier. So, we need to fill it with appropriate and sterile water. If needed, fill the humidifier bottle. Now, attach the connecting tube to the humidifier outlet. Attach the prescribed oxygen tubing and delivery device to the humidifier. And set the flow rate according to the doctor's order. Turn on the oxygen at the prescribed rate and ensure proper functioning. Now for the nasal cannula, fill and determine if oxygen is flowing through the tips of the cannula. The nurse should fill the oxygen at the outlets of the cannula, mask, or the tent. Now place the tips of the cannula in the patient's nose with the prongs fitting into the nares. The outlet prongs are filled into the nares and the tubing is hooked around the ears. Adjust the straps around the ears of a snug, comfortable fit. If the cannula will not stay in place, tape it to the sides of the base. Pad the tubing and band over the ears and check bones as needed. And now for the simple face mask. Guide the mask toward the client's face and apply it from the nose. Fit the mask to the continuous of the patient's face. The mask should mold to the face so that very little oxygen escapes into the eyes or around around the cheeks, around the cheeks and chin.
Sana kami nabili sa pagluto.
Secure the elastic band around the patient's head and adjust the strap so the mask fits securely. The mask should be comfortable but snug from the patient. If the receiver bag is attached, the oxygen flow must be at level. Supposed to be that we have here a oxygen or the receiver bag. The oxygen flow must be at the level to prevent the bag from fully collapsing during the patient's inspiratory efforts. The reservoir bag must not totally deflate during inspiration to avoid carbon dioxide build-up. Now adjust the size of the face mask or tent to ensure a snug yet comfortable fit. Mist should always be present when using a face tent. This is to facilitate comfort. And now for the tracheostomy collar. So supposed to be this is our tracheostomy collar. Connect the tracheostomy collar to large bore oxygen tubing and to the humidified oxygen source. Mist should always be visible. So attach the large bore tubing coming from the oxygen source to the swivel adapter or the collar and assure that the nebulizer delivers from constant mist. Now adjust the oxygen rate to 10 LPM or as prescribed by the physician and adjust the nebulizer to connect F102 setting. Set oxygen flow rate and concentration as ordered. Now apply the tracheostomy collar so that it loose covers the patient tracheostomy. Place collars opening directly over the patient tracheostomy tube. Drain excess water from the tubing as needed. The tubing must drain away from the patient to prevent draining contaminated water into the sterile distilled water and contaminating the humidifying unit. A condensate trap may be necessary to reduce the risk of condensate aspiration. Empty any build-up of condensation to reduce risk of condensate aspiration. Clean the collar with soap and water every day or more frequently to remove secretions if necessary. Clean the tracheostomy collar as needed to remove the secretions. Now instruct the patient or the caregiver on suctioning. Use the frontal suctioning port of the tracheostomy collar. The patient or the caregiver can use teach back method to demonstrate understanding of instructions. Tunay, pero naman siya. Dito na dito, clean the collar.
Ginan, mamati po na di tissue na.
Karatas.
Spraying nose na.
Now, clean the collar with soap and water every day, or more frequently to remove secretion if necessary. Now, instruct the patient or the caregiver on suctioning. Use the portal suctioning port of the tracheostomy collar. Instruct the patient or suctioning. Use the frontal suctioning. Inawala kang caregiver.
Mamati po.
The patient caregiver can use teach back method to demonstrate understanding of instructions. It's supposed to be that we already have instructed the caregiver. Now, we can now provide the patient comfort measure to ensure safety. And finally, we have to document the procedure done, the equipment that we used, the liters of oxygen per minute, and the cardiopulmonary status, and also the patient response on the chart. And that will be all. Thank you.
Sa gulo